I would like to introduce someone who is representing the Vision 16 Clinical Resource Hubs to the stage. We have had the honor of getting to know many more people from the Clinical Resource Hubs in the past year, thanks to lots of conversations by Dr. Bailey, Dr. Kirsch with the Clinical Resource Hubs. I myself have had lots of conversations with Clinical Resource Hubs, but we're so grateful to have you here because, as you've heard in multiple conversations, getting these devices into the hands of patients in their homes is a key priority for our healthcare organization, as well as the VSOs, as you just heard in one of those last panels. So thank you for being here. And this is Michael Willis. He is the Vision 16 VA Clinical Resource Hub Substance Use Disorder, or SUDS, Program Coordinator. He is a physician associate who has worked with the VA for almost 10 years in the fields of mental health and substance use disorder, and has a passion for serving veterans who are struggling to break the cycles of addiction and mental illness. Michael lives in Shreveport, Louisiana, with his spouse of 15 years and their 4 children. Those probably keep you quite busy. But thank you for being here, Michael.
Thank you so much. Thank you, and thanks everyone. And what a great presentation to follow up after. I know I'm wedged right between break, and so I will try to keep this right on time. I know we're a little behind. So most of you might already know about the Clinical Resource Hub. It's been around since 2017, before it took on that name. And this was a VA initiative that was looking to get ahead of the times here and start providing virtual care at home. It started with primary care, primarily, and they were just thinking, okay, well, how do we kind of extend reach to veterans who may not be able to get into the clinic, may not have ready access to all the resources. And then a pandemic happened. And they realized, oh wait, we weren't ready for this. And it exploded from there. In 2020, it officially became the CRH. And it could be an entire conference just on all the things the CRH is doing across the nation. There are so many things, but formally became that in 2020. And this is just in Vision 16, which is where I am from, which covers that kind of East Texas and the South, Louisiana, Mississippi, and Arkansas. And so these are just some of the programs that, again, initially started as just primary care and mental health, is now doing pretty much everything that you can imagine the VA is offering in a virtual setting. And so this is patients getting their cardiology appointments at home, patients that are seeing their GI doctors at home and then coming in and getting their procedures done, and looking for ways to capture veterans who maybe aren't so close to the VA sites. And so most of you know VAs are built upon that kind of primary site with the C-box that spin off from there. But a lot of those patients don't even live in those areas. They live quite far away. So my team is a small team that I lead, but I give them a shout out here because I couldn't do all the things I do without them. And it's just the tip of the spear, all the admin people and supervisor teams and all the things that are out there that make these programs work as well. So what got me interested in telehealth? Of course, I am a clinician, so I actually am prescribing and seeing patients with the VA full-time, 100%. And so I recognize that most people live in cities, but a lot of people don't. So, and being an end-of-the-day presentation here, and several of these statistics actually have come up throughout the day, so it always makes me laugh a little bit. So around the 60 million people in the U.S., and then about 1 in 5 of those are living in rural America. And so I just came back a couple weeks ago from a Midwest trip with my kids and saw lots of rural America between Yellowstone and the Badlands and all the areas out there. And these are people who don't have access to services. They're not even close to a CBOC or a residential site. So about a third of the veterans enrolled live in a rural area. So that's a ton of veterans that are outside that kind of normal catchment area. And so age mattered. We, of course, much has been mentioned earlier. A lot of our veteran population is aging, but we also have a lot of OEF, OIF veterans that are right in that area where they are, as people talk about gaming, they've talked about other social media, all the things. These are veterans who are looking for alternate ways to engage in medical care. And so this was an opportunity that I felt like we could engage with, especially being a program that's already attempting to kind of capture veterans in a more comfortable setting, maybe at home. So our vision for my program and our program in Vision 16, and there's no national model for this. This is a thing that's being created kind of as we go, was to reduce overall suicide rates and overdoses, improve retention and engagement, and then providing new evidence-based therapies for substance use and using immersive technologies. Because again, there aren't as many substance use treatments as people would imagine in terms of evidence-based therapies or medications for that matter. The list is very short. I won't go through all of them, but it would not take long. And so a little bit about, kind of some statistics. And you'll notice on this slide that there is one substance that is not on here, and that is alcohol. So over 130,000 veterans receiving substance use treatment. That's intensive treatment. But, most veterans are receiving their substance use from primary care doctors or maybe the general mental health doctors. And so this number doesn't near capture the amount of those veterans. And so this is just showing the drug trends in the VA. Alcohol, especially after COVID, has skyrocketed, though. It was always the number one substance in the VA to start with, but isolation and such has done nothing but drive those numbers up. But I do kind of add this little kind of statistic here from a study, and people have mentioned the iPad initiatives, just examples showing that technology does work and that veterans are responding to that. And this is showing a 20% reduction in ER visits and 22% reduction in suicidal behaviors, which is astronomical. So speaking of treatments in substance use, again, not a whole lot of evidence-based substance treatment options to choose from. Most veterans historically have engaged in substance use treatment utilizing inpatient type programs, residential, domiciliaries, and those are great programs. But we considered and thought, okay, we want to engage veterans outside of those programs. Veterans who live in cities and have the means to do that, that's great. I think that's a great program from there, but not everyone wants to do that. And not all veterans are ready to do that when they may be ready to start some level of treatment, but maybe they don't have access. Obviously, substance use isn't contained to the cities. If you go to rural America, there's cities just decimated by opiates, by alcohol, by methamphetamines, depending on what city you're at and where at. You'll find the substance that typically is the most rampant in that area. And so CBT SUD is something that we are offering in our program. But also, we're going to talk a little bit about these headsets in a little bit. That is going to be offering a form of this as well. If you're not familiar with CBT, again, that's the therapy that looks at thoughts that create feelings, that create behaviors, and those cycles that tend to come into you. So for veterans with substance use, you're looking at a trigger, causes a thought, maybe they stop at the gas station, and then they end up with, a 6-pack or a 12-pack or whatever. That little tiny trigger, maybe getting gas, is all it takes to kind of start that cycle again. And so kind of interrupting that cycle as well. And CBT works. It is actually quite good, a good therapy model, and does show that it does reduce substance use. So talk a little bit about the TST-VR. I'm not affiliated with them in any way and have no endorsement or no, anything with them. But it is an exciting program that we're looking to offer our veterans in Vision 16. They actually do have a little booth out there, though, that you can definitely feel free to check out if you want to. But the idea behind this is a means to not only reach our veterans in a new and exciting way, but a way to do that doesn't have a lot of barriers. And so one thing that we were particularly interested in the rural population is a lot of these people don't have high-speed internet. They have dial-up or, maybe basic DSL or satellite internet, which is unreliable depending on the weather. And so a lot of different types of, a lack of those resources that may be traditional that we, in the cities that we have. And a stable infrastructure. So we are looking at headsets that do not require all those extra bells and whistles of internet, connections and things that we can send in the mail, things that we can get into the hands of patients at appointments, both outpatient and inpatient as well. And so TST VR is an interesting prospect that we definitely are excited about. And so I have a little statistic for them, and again, this came up earlier as well, just showing that retention and engagement with VR is higher than the retention without it. And again, with substance use, that is one of the most important things, is keeping veterans engaged and keeping them there. Because again, you never know when someone is going to be interested in seeking treatment for substance use. It's very difficult to even, have veterans open up to talk about that. It takes a lot of honesty and a lot of trust to bring that up with their provider. It's not something that just comes up in a screening and that they're excited to talk about. It's embarrassing, it's stigma. Mental health already has layers and layers of stigma associated with it, but when you add in the layer of substance use, it just becomes even more complex. And many of these veterans, their family may not know, and so they don't want anything in their medical records or anything that jeopardizes any of their resources, or they may fear that at least, some type of retribution on medications. It might affect what they can be prescribed. And so there's layers and layers that go into that. And so capturing those veterans when they are interested and when they are motivated is extremely important. And so we have a very short video I'm going to show here just to talk a little bit about that VR program itself. Hopefully we have that video pulled up here in the back.
In early 2020, Lighthouse XR partnered with a groundbreaking integrative cognitive behavioral therapy treatment called Transcending Self-Therapy, or TST. TST is a successful, evidence-based approach to substance abuse therapy that is spreading across the Veterans Health Administration. And together, we are creating a place called TST VR, also known as The Retreat. In TST's Retreat VR, we aim to significantly increase the practice and comprehension of therapy outside of traditional sessions. Rather than the conventional pen and paper assignments, we use virtual reality headsets to create an immersive, engaging, and distraction-free world so that patients can really focus on their recovery. Although we are a virtual experience, we understand the value of in-person treatments. We are not here to replace therapy. We're here to add to it. And in the Retreat VR, every session is expertly crafted with clinician input and feedback to augment TST's highly successful curriculum. You can review key concepts, practice life strategies, experience guided meditations, and hear from others who have been on a similar journey toward recovery. Using patient, staff, and feedback, the program has been continually refined through multiple iterations and has expanded from 1 to 4 locations. In 2021, we set out on an initial 18-month clinical trial. The results, published in a recent paper, have shown an overwhelmingly positive response to this treatment, and we are happy to share with you our progress.
Hey, welcome back. You took a big step today, a step that a lot of people don't take. It's a step towards your recovery. It's a journey, and it's a journey that I think is going to take you to a recovery and a much better life.
Great. Okay. Yes. So that is the Lighthouse XR program. Again, just as a clinician, as a provider who is having the opportunity and privilege of seeing veterans face to face and virtually, we're always looking for opportunities to enhance care for veterans. And so we are excited in Vision 16 to be working on getting headsets into veterans' hands, both inpatient and outpatient, for substance use, and especially programs that have been designed by VA clinicians for veterans and by veterans. So Jared, Dr. Reese Weiber, he's in the building somewhere, and he would love to tell you, I'm sure, all the great statistics. He's really excited about it. It's always great to talk to him. So, but again, I guess as my time is running out here, and so I just want to thank everybody for the opportunity. And if you have any questions about the Clinical Resource Hub, I'm happy to answer them. There are, again, so many exciting programs and new innovations and techniques that are being used at the Hub. And thank you.